Jamison, the Nursing Program Director here at the Technical College of the Low Country. Our first nursing program was established in 1976, and that was the PN program for those individuals who were interested in becoming licensed practical nurses. In 1981, we added the ADN program, or the Associate Degree Nursing Program, for those individuals who are interested in becoming registered nurses. Since then, we've added a third option, which is the LPN to RN program, and that's designed for those people who are currently LPNs who are looking to come back and complete the associate degree to become a registered nurse. Since the inception of our nursing programs, we have graduated hundreds, maybe even thousands of nurses. Many of those nurses still work right here in our own communities. So let me talk a minute about our program and how our courses run and how they work. Once you complete your general education requirements, and that's going to include courses such as English and psychology, humanity, math, sciences, then you become eligible to apply to our program. If you choose the PN option, once you're in program, it will take 3 semesters to complete. If you choose the ADN option, once you're in program, it will take 5 semesters to complete. If you're doing the LPN to RN option, and we refer to those students as our AP students or advanced placement students, these students are given credit for their previous nursing courses. So when you come in, it's in the 3rd semester, and it typically takes you 2 semesters to finish. Once you complete one of the nursing programs here at TCL, then you become eligible to take the NCLEX, which is the National Licensing Exam to become a nurse. You would either take the NCLEX PN to become an LPN, or you would take the NCLEX RN to become an RN. Our classes have a didactic design, which means we have typical lecture, which would be 1 or 2 days a week, and that's where you would have an instructor in a classroom, and you would be using things like PowerPoints or course notes to take notes, ask questions, and interact with your instructor. Our courses also have a lab component, and that's 1 day a week per course. We have labs in Beaufort and at New River, and these labs are interactive. In lab, you're not a bystander. You're learning skills. You're learning to do things such as start IVs, put in catheters, or do a head-to-toe assessment. In our nursing labs, we use mannequins. We have basic mannequins that are used to learn things such as how to give a bed bath or how to take vital signs. And we also have high fidelity mannequins, which are used for more sophisticated procedures and assessments. These high fidelity mannequins mimic real human responses to disease processes and nursing interventions. And simulation is a great way to learn, because you can learn in an environment that's very realistic without any danger of any harm to a real patient. We also have the clinical portion of our courses, which are 1 to 2 days a week, depending on which course you're taking, and they can be anywhere from 6 hours to 12 hours in length. We use facilities around the Low Country, including Beaufort, Jasper, Colleton, and Hampton counties. We use a variety of facilities. We use hospitals, nursing homes, outpatient treatment centers, home health agencies. We utilize a variety of experiences. There are a lot of clinical hours that are required for our programs. As an example, our associate degree program is about 600 clinical hours that has to be completed in order for you to complete your nursing degree. The market for nurses in South Carolina is very lucrative. As you can see, we're in the middle of a pandemic, and so nurses are at the forefront and they're very much in demand. For an LPN in South Carolina, the beginning nursing salary is about $42,000 a year. For an RN, it's about $60,000 a year. What's really exciting about nursing is that there are so many options for employment once you graduate and become licensed. You can work in hospitals, you can work in schools, you can work on military bases, you can work in surgery centers, in doctors' offices, you can work in an occupational health role, an infection control role. It just seems like the list is endless. So it's a very exciting career option. One of the best things about the nursing programs here at TCL is that you can get all of the general education and nursing classes that you need to complete your degree right here at TCL. You can get everything you need right here at TCL to complete your nursing degree. If this is something that you're interested in, please reach out to Miss Amanda Barney, who is our Health Sciences Advisor, and she can help you develop a path so that you are eligible to apply to our programs. We really hope that we'll see you soon, and thanks for stopping by.
Good afternoon, students. Today we're going to be discussing cardiac dysrhythmias. Across the screen here you will see the EKG going across. You will correlate what you see going across the EKG strip here. You want to assess your patient's rhythm, what you think the rhythm might be for the patient, and then correlate your findings across the screen here with your assessment findings of your patient. We're specifically going to be looking for your cardiac and your respiratory assessment findings, okay? You can also attach your pulse oximetry if you need to, if you think that would go along with your assessment of your patient's cardiac dysrhythmia. Okay, any questions?
No.
All right, you may begin.
Okay, I'm gonna wash my hands. Hello, Mr. Smith. I'm Rashida, and I'm gonna be your nurse for today. And this is Carrie. She's
Hi,
going
Mrs.
to
Smith.
assist me, and we're going to do a cardiac and respiratory assessment on you. Okay?
We're just going to raise your bed up a little bit, and we're going to listen to some heart sounds, and then we're also going to check your blood pressure and your pulse ox. Just going to sit you up a little bit more. Is it okay if I take your gown down to listen to your heart? Okay, I'm going to first start by listening to your apical pulse.
And while she's doing that, I'll listen to your lungs.
I'm going to listen for a full minute. I'm going to check your radial pulse as well. I'm going to come up here and listen to your atrial. Okay, we're done assessing your heart and your lung sound. Can we do anything to help you feel comfortable right now? We're gonna go chart what we just did, and we will be back in just a little bit.
Hello everyone, and welcome to Sim Orientation. My name is Sage Voglia. I'm going to tell you a little about myself. When you're ready to learn about me, go ahead and feel my carotid pulse. As you can see, my eyes blink, my tongue can swell, and my airway can be manipulated. I have many fantastic airway features, and I can be bagged, intubated, and trached. When you are finished examining these features, go ahead and feel my left brachial pulse. I have many sounds you can auscultate for, including hard sounds, lung sounds, vowel sounds, and blood pressure. I can also be defibrillated, attached to a monitor. I could be needle decompressed, and you can even insert a chest tube. Done examining all my sounds and features. Go ahead and feel both my left and right femoral pulses. Oh no! What is happening to me? What is going on in that monitor? Can someone please silence that alarm? Oh, thank you. That is so much better. As you can see, you can interact with my monitor. It is a touchscreen monitor. You can also use this monitor to obtain 12-lead EKGs, lab results, x-rays, and multimedia files. Please take a moment to interact with this monitor, and when you are ready, go ahead and feel my right pedal pulse. Before you take such good care of me, please remember to always wear gloves when handling me, keep pens and papers away from me, and only use paper tape when attaching IVs and other things to my body. Please remember to treat me like a real person. I can really use some good care. Remember to learn, have fun, and always listen to your instructors.
Well, as you probably know, nursing school is going to be challenging. My advice is to embrace that challenge. There will be times where you'll feel like maybe you're a little overwhelmed or you're struggling, and I like to think of those as growing pains. The important thing is that you persevere and that you adapt. To me, those are probably the two biggest qualities that will help get you through nursing school, and at the end, it will all be worth it.
The thing I'm looking most forward to is the endless job possibilities that I can do with nursing. Personally, I think I'm gonna go into either labor and delivery or pediatrics, but thankfully through TCL's nursing program, we can explore all those through clinicals.
I would tell them to not listen to anyone that came before. A lot of students have their own different opinions about the tests and the material. Just find your own way to study. Whatever works for you is not going to work for the person before you or after you. So just don't get freaked out. People are going to tell you it's really hard, but just keep on doing whatever you need to do to get through the course.
So a big thing that I've really enjoyed learning is learning how to critically think. So learning to apply all of the knowledge that you do learn to real life situations instead of just memorizing the information. And you might come into the program thinking you don't know how to critically think, but it is something that will grow on you and follow you throughout the whole program.